My name's Tom Simpson. I'm an optician working in Scotland, and I was diagnosed with stage 4 lung cancer 14 months ago. I was told I had less than 12 months to live, and at that point when I was told, it stopped everything for 4 months. You're in such shock. Subsequent to that, I found out that there's treatments available, which have meant that here we are 12, 14 months on. I'm in better shape than I was more than a year ago. The oncologist consultant has been fantastic. From the first appointment, she was very positive, and she had to undo some of the work that had been done by the surgical consultant. And after the first meeting, she sent me emails highlighting exactly what my diagnosis was. This is really important because you don't really listen. In every appointment that you go into, you don't listen. You literally, everything is a white mist. And it's only after you get the paperwork afterwards that you can possibly work out what's happening with you. I've been very lucky that my healthcare professionals have, if I phone up and ask for something, they understand I probably know more about my condition than they do. And my doctor allows me to get medications when I require it by a phone consultation. My surgeon, my oncologist will get back to me by email if I allude to a question. And I also have a clinical nurse who I go to save the oncologist time. So actually, I probably communicate with my oncologist less because I have so many people who support me. And I think that's very good because the oncologist time should be concentrating on people who need more care at this point. I've been very lucky that I work part-time now. I tend to still work quite hard on those days I'm in and do as much as I probably did before. But I've got very supportive colleagues who allow me to work part-time, and that's working very well for me. And the medication that I'm on is a biological therapy, which allows me really, my energy levels not to fall by as far as some people who've maybe had chemotherapy. The work-life balance, when you get a diagnosis like this, becomes far more important. And I've found that essentially I've spent a lot more time with my family. Having a life-limiting disease, you tend to have to concentrate on making sure you spend as long as you can with your children and family. But you still need to pay the bills, so you still need to work, and I've managed to find a happy compromise, but mostly down to the colleagues that I work with. In terms of advice I'd give any other people when you're first diagnosed is don't just look at the statistics. You are not a statistic, you're not a number. I shouldn't be here if I was going to look at statistics, and I am. I think it's very important that you can't stop yourself looking at all the negative stuff and all of the bad stuff, so try and balance it up with looking at some positive websites, some websites that can give you hope. Inspire.com is one example. I hope that in future that patients' hope is not taken away with the first person they see. It's very important that everyone has hope from the moment they're diagnosed, and there is new treatments coming along all the time. The treatment that I'm on wasn't available 3 or 4 years ago, and now it's old school. There's something new already come along, so there's always something coming along. Keep yourself in good fettle, and then hopefully you'll still be around when something else comes along.